Over the past 15 years, the use of opioids have turned into a now called epidemic. In these last 15 years, the epidemic has risen rapidly, killing almost 15,000 people in 2015 alone. Non-prescribed opioids have led the way in this epidemic. More than 90 Americans die every day from the use of opioids. The opioids that are most common in this epidemic are hydrocodone, oxycodone, heroin, Oxycontin, Percocet, Vicodin.
As a public health emergency.
Doctors began prescribing drugs containing opioids very regularly in the 1990s. The addictiveness and deadly potential has been known for years. This caused doctors to search for an alternative to opioids, but they had trouble finding one. Doctors figured out it was impossible to get rid of opioids fully because then there would be no painkillers that are needed on an everyday basis. Populating with many people dying. Deaths involving synthetic opioids have risen 540% in just 3 years. Death rates among opioid use have skyrocketed since 2000, going up by about 33,000 total deaths from 2000 to 2016. Surprisingly, drug overdoses kill more people than gun homicides and car crashes combined. The state with the most amount of overdoses is West Virginia. Doctors are taking blame for the epidemic. The medical professionals feel they overprescribed and took patients suffering further than needed. Dr. Charles Hannon, who is a well-respected orthopedic surgeon, claimed, "We need to take a little bit of ownership with this whole opioid epidemic and say, what can we do?" Doctors feel they need to make an impact on the crisis since they are part of the reason why it started. Epidemic as a public health emergency. Trump's plan includes getting treatment to patients in rural areas, having states hire more substance abuse counselors. Also, he thinks allowing for funding to be shifted to focus on victims of the opioid epidemic will help cure the issue. The opioid epidemic has caused for filled jails and overpopulation. In addition, hospitals are overpopulating with many people dying. Among the more than 4 million patients requiring acute care, the researchers found 21,705 were admitted to intensive care units due to opioid overdoses. This opioid epidemic is very economically costly because the treatment is high and the problem is very hard to stop.
On Monday, the White House panel responsible for handling America's opioid epidemic released an interim report in which they urged President Trump to declare a state of emergency. The commission, led by New Jersey Governor Chris Christie, was formed as a result of an executive order in March. The report states, "Our nation is in a crisis. Your executive order recognized that fact. The work of your commission so far acknowledges the severity of this national problem." As evidence of the severity of America's opioid crisis, the report offers the following statistics. 142 Americans die every day from a drug overdose. Drug overdoses kill more Americans than gun homicides and car crashes combined. In 2015, nearly 2/3 of drug overdoses were linked to opioids like Percocet, Oxycontin, heroin, and fentanyl. Since 1999, the number of opioid overdoses in America has quadrupled. And 4 out of every 5 new heroin users begin with non-medical use of prescription opioids. To combat this epidemic, the Commission recommended a number of measures, including granting waiver approvals to all 50 states to reduce barriers to treatment, education courses for doctors to avoid the unnecessary prescription of opiates, and enhancing interstate data sharing to prevent controlled substance diversion.
We interviewed 2 teachers here at Staples High School. We asked them their prior knowledge about the opioid crisis. We asked them about statistics to go along with the death rates. And we asked what are possible solutions that can help America in the future for the opioid epidemic. First, we interviewed librarian Colin Neenan.
It's a real crisis. In the past, people have been, talking about crises with drugs and saying, saying that thousands of people are dying, but it does sound like this time thousands of people are dying. So it sounds like a real epidemic.
Mr. Neenan was not aware about the statistics or the death rate.
This is a really tough question because, I do think they have some things that they want to do, but whether or not Trump will try to do them or spend money on it, that's the real issue. He's he tried to cut back on costs on what was going to be spent for healthcare. And in fact, this tax bill is going to affect the opioid epidemic because it is going to reduce the amount of money that can be applied to the epidemic. So, in terms of knowing what would work, education. Well, okay. The one thing that I would say is, you need to stop. You need to talk to stop the doctors from being able to prescribe as much, and you need to stop the pharmaceuticals from saying, "Oh, they're fine. There is no problem. They are not addictive."
Mr. Hyder. Mr. Hyder has past and previous knowledge about the opioid crisis.
I know that it's a serious problem. I can tell you that, especially when people, let's say they're prescribed prescription medicines such as oxycodone or Vicodin or any one of these opioids, a lot of times they don't need the full prescription, and a lot of times they're left over in their medicine cabinets, if you will. And you got to be really careful for that, especially if you have young children in your home. A lot of times they'll go out and they'll take these pills and they'll use them for recreation purposes. Other things too, sometimes people who really need these pills, something having to do with their pain management hasn't been monitored by their physicians well enough. So a lot of times what physicians will do is, like, if you're in pain, you'll say, "I'm in pain," and they'll get an opioid prescription. And instead of going through, like, let's say physical therapy or maybe finding the root to the problem, physicians oftentimes will just continually prescribe these opioids. On the radio, and Governor Christie is a huge proponent of it, and he often will regurgitate these statistics, and they are huge. It's a big problem politically, although he's someone that I'm seeing that taking a stand. The solution's got to start from the home. People got to start realizing what they have in their homes in terms of opioids, and they have certain banks where you can turn things in. I think a solution is just basically raising awareness. We did have somebody come to my daughter's school last night to speak about opioid addiction and how it's the beginning. Like, people go from opioid addiction to things like heroin. So how do we stop it? I think just raising awareness. I think students need to be aware. It starts in the home.
After analyzing our survey responses, it is clear that many people feel prescription and distribution of opioids is the main problem. People also feel education and support groups regarding the issue would help as well. The responses suggest that there is no exact timetable for the end of the crisis. Some think it will end in a couple of years, while others think it will never end. Overall, the responses convey that less amounts of opioid prescriptions and more support groups will help steer this issue in the right direction.